Most of us wouldn't dream about smoking 15 cigarettes a day, but are we unwittingly setting ourselves up for this kind of health risk in retirement? That's what I'm thinking. I teach a retirement course over at the local community college for the last couple of years here. And one of the topics that we talk about is managing healthcare costs, but then also just managing health in general, which is a big part of enjoying our golden years. And as I was getting ready for this year's class, it reminded me that that last fall in What I'm Thinking number 17, I had actually referenced a slide that I use in class, and it was about it was in the three things section of What I'm Thinking, that number 17 issue, and it talked about a study that came out about how much time we spend alone over our lifetime and really how it increases as we get older. And I'll pull that article up here. We'll put a link back to number 17 so you can see it, so you can go and take a look at the blurb for yourself too. But take a look at this snapshot here. Of course, the bright red line up in the upper right says, time you spend alone versus with your partner, with family, children, friends, coworkers, etc. And not surprising, right? In the early years, you spend a lot of time with family, and then in your 20s and 30s, a lot of time with your children and with your coworkers. And of course, as you get older, the kids get out of the house, right? You stop working, and you don't spend very much time anymore at all with coworkers, right? So some of it not surprising, but what I thought was really interesting in this is I was thinking, hey, in 60s and 70s, you have a lot more time alone. Check out where that line is on alone time in your 40s and 50s. Right? Just increasingly more and more time spent alone. And the point that I make in class is how to be intentional about making sure that you're staying engaged and active. And, there's data that's out there that says being lonely can be bad for you. So that's what I have been teaching in class. And that this graph, I think, is just really interesting to think about that. But then this fall, I was reminded as I was preparing for this fall's session here, over the summer, I'd read an article in the local paper that talked about a Surgeon General report that had come out, sort of quantifying what this means from a health standpoint. And we'll put links to that article and the Surgeon General's report in there. But one of the takeaways was that the Surgeon General had done the research and said that loneliness has that same negative effect on physical health as smoking up to 15 cigarettes a day. And, I'd been sort of thinking like, hey, it's not good to be alone and, emotional health, those sorts of things. But literal physical health, things like heart disease and cancer and dementia caused by being lonely or directly related to that. So in addition to all those other things that I thought, hey, it's not good to be alone. We got to be intentional about how we can stay engaged to the extent we want to. Now there's evidence that literal physical health can be damaged by being lonely. And as that chart from the original article shows, increasingly as we get older, we're more and more alone, and so being intentional about how to mitigate that and to move forward as we get older by not being lonely or putting ourselves in a situation where it's not a default. I think it's a really important thing to consider and an important thing that I wanted to share with all of our viewers here. So that's what I'm thinking about today. As always, I'm interested in knowing what you're thinking about or your personal experience with this, perhaps. If you're watching on YouTube, jot a note in the comment box or shoot me an email directly. And as always, thanks for watching.